Folks, we're bringing forward the presentation, Food Ladders, a framework for moving beyond emergency food. And this presentation will be given by Dr. Megan Blake, who's a senior lecturer in human geography at the University of Sheffield. Megan will introduce the Food Ladders framework as a mechanism for moving beyond emergency food support. Thank you.
Thank you all for having me today, and thank you for letting me jump ahead. I have a flight to catch, so I'm a little bit worried about that. While we're all talking about income-linked food insecurity today, I'm going to use the terms food insecurity when I talk about this work, rather than the term food poverty or the term food security. When you talk to people, I'll do this purposefully, when you talk to people who are struggling, they don't describe themselves as in poverty. They describe themselves as having stretched resources, as struggling to cope and feeling under stress. Poverty for them is always somewhere else who is worse off. They can always point to somewhere else, and that's not them, nor is it aspirational. It introduces quite a bit of stigma. So that's kind of my justification for moving away from the food poverty language to really try to highlight the notion of food insecurity. Next slide, please. So my argument today has sort of 5 points. Food insecurity is not a static state. People enter and exit at different levels at different times, depending on their life circumstances and to what's going on. And those life circumstances and what's going on in the wider context contributes to their vulnerability. Vulnerability is increased or decreased depending on national, local, and individual resources that people have available to them. So food security has a geography to it that is scaled. Food insecurity is more than economic. While we talk about the economic, and our questions that we ask in our surveys are about can you afford, and as I'll describe a little bit in just a minute, it's actually much more than economic. Food has capacities beyond nutrition and calories, beyond its commercial elements. Food can be used to help repair places and replenish resources, those social resources that we also need to be food secure. But when we talk about interventions, and I often get asked, is there any one intervention? What's the best intervention? And I would say that there needs to be different levels and configurations of support depending on people's circumstances to meet their specific level of food security, as well as their local and community needs. Next slide, please. So I too have been analyzing food and U2 data. Seems to be a theme. I looked over the 4 waves that are now available, and it looks quite, there's been some change. We began to see a little bit of recovery just as we were coming out of COVID, back when the £20 universal credit uplift was still in place, and furlough, but then that rapidly began to disappear. I think what I really want to highlight are a couple of key points from this slide. Firstly, 1% change equals approximately 500,000 adults. 500,000, I'll let that sink in for a minute. So it looks little. It looks like we're going from 72 to 73 or 73 just down to 70. Not a big deal. That's small, isn't it? That's a lot of folk. That's a lot of people. And a lot of those people have kids at home. The second thing I want to highlight is that transitions happen differently for different groups. So when you look across the numbers, you can see that actually when you're in severe food insecurity, recovery takes longer and then happens rather quickly again, whereas repair and recovery happens faster in those other 2 groups. People come out of food insecurity in the sort of worried group and the low food security group a little bit faster than the marginal group. The numbers stay kind of the same. So if we can capture people and catch them before they end up at that very bottom rung, at that very bottom space, our chances of helping them to recover are much quicker. Next slide, please. So I want to talk a little bit about the geography here, and I've on this is from the Wave 3 data. And I'm focusing specifically on the very food secure in this graph. So just those who are food secure, I'm doing this for reasons. I've included the marginal group out of this. And I'll do this, I'll explain this in just a minute. The graph on the right shows that Northern Ireland isn't hugely different from the United Kingdom as a whole. Over time, between wave 3 and wave 4, some areas became more equal and some areas became less equal. The most deprived areas have the least amount of food security. However, in that transition period, the quintiles 2 to 4 registered the greatest decline in food security. So what we're seeing is an increase further and further up, sort of the deprivation, or further and further away from the least deprived areas. More and more people across spaces are experiencing food insecurity. And this is really variable across regions, and I haven't included this data, but I have it if you're interested. Looking at it, one of the more interesting regions, the east of England is incredibly wealthy and thought of as being incredibly wealthy. In areas of very high or very low deprivation, the rate of full food security is about, it's somewhere in the mid-80s. If you look at the most deprived quintile in that same region, it has the worst levels of food security. Somewhere around 36% of the population is food secure in those areas. It's much more even here in Northern Ireland. So it's the disadvantage is emphasized regionally. There are place-based elements in effect. If we compare rural to urban areas, in rural places, those with less than £32,000 a year are less food secure in rural areas than are in urban areas, and those with greater than 32,000 are more food secure. So there's kind of an economic divide whereby there is a rural advantage for people earning over £32,000. However, the cost of living crisis and its pincering in on heat and transportation means that this relationship is likely to change. It's likely that there is that rural advantage of being able to grow your own and so forth is going to disappear somewhat. So we need to be thinking very carefully about what we're doing in rural areas and how we can support rural people. All right, next slide, please. When we look at people, there are rates of, and we've kind of talked about some of these, so they shouldn't come as a big surprise. But when we look at levels of vulnerability, so for every adult without children, there are 1.75 more adults with 1 or 2 children who are food insecure. When we look at households with 3 or more children, and there is policy that links to this that we can point to, those those households with 3 or more children are 3.3 times more vulnerable to food insecurity than a household with no children. We can see similar sorts of relationships, maybe not quite as extreme, when we look at BAME communities and when we look at people with long-term health conditions. But the one that is really striking is when we look at people with poor health. So not necessarily with a long-term health condition, although most people with poor health are also have long-term health conditions. But when we look at this group, they are 6 times more likely to be food insecure compared to somebody who is in good health. All right, next slide, please. And I also just want to point out the issues around what people do, where their money comes from. And I want to highlight that actually, it's quite clear from these graphs that people who are not working or who are unemployed are struggling the most. Absolutely, they are struggling the most. And the rates of food insecurity are deep for them. But it's not just them. There is a large group of working population, full-time working population, who is food insecure as well. Okay, next slide, please. So I want to talk now a little bit about food insecurity. We know the definition, we've heard it already, but the UN defines food insecurity as having 4 pillars. There's 4 areas. This is access, availability, utilization, and the stability or the consistency of being food secure across time. Now, when we tend to talk about access, and we assume the legal aspects of access, that we won't be precluded from going into the shop if we wanted to go into it. provided, that we want to go and buy things. So we tend to talk about access as about affordability. Can I afford the food that I need? And certainly all our questions in the surveys that we ask hone in and focus on this. And a lot of the American research has also made the statement, it's all just about poverty, it's just about poverty. But if we look at the other pillars, we can also see there are links, and we certainly saw this during the pandemic. Availability is about food being in the place where people live. Why should people have to travel further and pay more to get the food that they need just because they live in a place that isn't equipped with the things they need? That food isn't available in a place. This is what we need for a fair and just foodscape is food in the place that's healthy and helps people to live their best lives in the places where they live. The cost of food is not just the transport cost, but also the time and the effort. We spoke to people during the pandemic who became food insecure because they had to change where they shop because they couldn't go out, and they were relying on volunteers to help for them. They were relying as a result on the local shops that had less but cost more, which meant then that they needed to go get food support. So if we look at availability, that's all about what's in the place where you live. We know also that foodscapes become impoverished when people stop buying because of the kind of commercial relationships we have with food. When people stop buying food in the local place, it stops being profitable, and supermarkets stop selling it. So when I go down to the shop down the road from where I live, even though it's a small supermarket, small, petrol station type supermarket, there's quite a large vegetable selection because I live in that kind of area. If I go to the same kind of supermarket down by where I work, which is right on the edge of the council estate, the vegetable selection is 2 baskets. There's some old looking carrots and there's some sorry looking onions and maybe a few potatoes. And that's it. That's it. That's all that's available. And it's because from that perspective, there isn't the demand. But there's a recursive relationship. There isn't demand because there isn't cost and there isn't the quality of food that people want to buy. And they can't afford it, so they can't buy it. So it disappears. So as a result, people stop knowing what those foods are. We learn, our diets become narrower and less diverse. Diet diversity is really important. Utilization then is also about, can we do things? We tend to think of utilization in terms of food safety. So is the food that we have access to safe for us? And increasingly, as people are turning the refrigerators off or not cooking things all the way through or eating frozen pizza straight from the box, we are beginning to see and recognize those safety issues and the worry that we have about them. And of course, that overlaps with these sort of financial aspects. But it also, utilization isn't just about safety. It's also about being able to stand at the cooker. If you are in poor health and you can't stand at the cooker for the duration it takes for you to do your cooking, you're going to have to find other ways to cook. You're going to be eating other things. If you are so stressed out because you've got those red top letters coming through your post box, and because your kids need a new pair of trainers for school, or because they've got a birthday coming up, or because you just don't know how you're going to make it through to the end of the month, you're losing that headspace. The people that I have spoken to in communities are some of the most amazing managers of their money and time and resources. They know down to the penny what things cost in all the local shops and are fantastic managers of their money. Not everybody, but the majority are. And they are so stressed out. They are so stressed out with this. And that takes its own toll, trying to add in, oh, well, if you just do this other little thing, if you just add in this other little bit, well, really what you need to be thinking about doesn't help at this point. So taking advantage, actually what people are needing is just a bit of a pause and somebody to hold their hand and help them. So food security is really about these other things as well. They're all baskets of resources that we have available to us. It's about having them all the time where we live in our daily lives. All right, next slide, please. So food insecurity, as I've already sort of indicated, settles into landscapes. It creates food deserts and lack of food in places, but it also settles onto people. There is a recursive relationship between mental health and physical health, that builds momentum as it deepens and deepens. The more anxious, the more you are, the less you're eating, the more poor you're getting in terms of your health outcomes, which makes it harder to utilize the food, makes it harder to go to the shops. It's harder to be motivated to do those other things that you need to do to help dig yourself out of the hole when you have to rely entirely on yourself. It's harder to utilize food and you access it from the shops when you can't even stand on the corner. These effects narrow landscapes, as I already indicated, and this has more than just the economic and health implications that I've had. Diet diversity is a key change that must happen if we are going to address climate change, something that people are worried about, including those who are food insecure. But if you are food insecure, it becomes difficult to participate in this societal activity because it is literally and figuratively out of reach. Some charity support and certainly government benefits demand that people prove that they were worthy by their lack, and this lack is cast as a personal failure or described as a personal failure. It's narrated in the news and on our social media by taxi drivers, as I found out yesterday, that it's a failure, it's a personal failure. FSA data indicates that just 27.3% of people who are severely food insecure are using food banks. So they're not reaching the people who they need to be reached. Some of this is because not everybody has access, but quite a lot of it is related to stigma. There are small tweaks we can do to make that stigma diminish. According to Dan and Miller, thrift is a key British value or key societal value. I have met so many people who are food insecure and who practice this thrift, but because they have to demonstrate deficit, that they aren't managing, that they can't do it, they lose the self-confidence to know that they actually are doing a really good job. They also are cast, because they're cast in this way, they think that they have no assets or nothing to bring to their communities. Everybody has something to bring to their community in order to support it. Finally, I have a little film that kind of talks about some of this called More Than Just Food, and there's a link at the end. There's a quote by a woman called Sam, who's absolutely fantastic. She runs an organization in her community called Edlington Community Organization. And she told me one of the first things she ever said to me was, when people don't have money to eat, they've not got money to socialize. When support relationships cast people as needy and the other as the savior, the ability to be reciprocal is undermined. Socializing is a key aspect or is a key element through which we practice reciprocity. It's something that is a part of our human fabric. And to deny people that ability to interact with others is as damaging as denying them the food they need to live a healthy life. And it's important for a physical and healthy body. We know from research that people who have strong social ties also live better for longer if they're, even when they do have health problems. Next slide, please. So this has all been really depressing. And it is. We're a wealthy country. Clearly, we need national interventions. We absolutely need policy shifts. But it's clear from the evidence that there are other aspects as well, and there is absolutely a local role to play in repairing and reshaping and renewing the resources that people have, including those social and food knowledge resources, not just the economic resources in a local place. So I've looked at what people are doing. The landscape of food support is diverse and creative and immense out there, and is a space of hope. It's not just the charity food bank that's in the corner where people are trying to do good and help their neighbors. It's much bigger than that, and it has a sort of different dimensions to it, all of which bring different levels of support. So Looking at this, I have a framework which I developed called the Food Ladders, and it seeks to provide a structure around how local scales to food support can help enhance the resources that people need to be able to reduce their vulnerability to food insecurity. It's both a framework for understanding and evaluating what is available in a particular location, as well as an approach that communities, food alliances, and community organizations can use for enhancing resilience or locating themselves within a wider landscape of food support. Broadly, there are 3 rungs. There's that catching space for those who are right at their end, who just need somebody to hold their hand. The next level up is for those who haven't reached that bottom space, who still have some of that mental capacity to manage, who aren't quite, at that point of absolute despair yet. These are people who have the headspace to learn new skills, who can support each other and still have confidence to do so. The top rung is actually about transformation, about innovation, and we are seeing that as well. And it doesn't just have to be economic transformation, it can also be social transformations. During the pandemic, I spoke to people who were in a line for a food club, and they were telling me about how they developed a WhatsApp group for all the people that they saw each week to check on each other during the week to make sure that they are all right. This is the sort of resilience that we want to build into communities, checking on each other, sharing, and so forth. So Food Ladders isn't just about the economic, it's about the food itself, it's about the social, it's about the economic, it's about health, and it's about other things like environmental sustainability. Next slide, please. So we can talk about sort of, while there are just 3 levels on the ladders, the basic, the catching sort of activity, the capacity building and the transformation, with small tweaks, we can see kind of a movement or little steps to help people move into. The idea is not to have levels, but actually to move people from one rung to the next. So if we look at a food bank, your basic food bank with the food parcel, people go and get it, and then they go home and then they make their meals from that. We can have a food bank plus, which brings in those support services that might help people to be able to get access and feel comfortable about accessing the resources that are available. It might include fruits and vegetables that they can cook at home. We then have things like food clubs or food pantries, which bring in a lot more resources, which may have volunteering opportunities, ways in which people can get involved in their communities and know each other, where they can exchange, be reciprocal, whether that's through money or through time. We then have cooperatives and buying clubs that begin to emerge from these spaces, where people are getting together to buy things, maybe from a wholesaler. And to start new, growing exchanges and recipe exchanges and so forth. It's about moving from doing for to doing with to doing by. Next slide, please. So there's a lot of things that we can do differently to remove the stigma that we can see in the food bank space or in that charity, that Victorian charity kind of space. And this includes allowing people or giving people space and opportunity to be reciprocal, to acknowledge the resources and the capabilities and the assets that they bring to the table, to recognize that they know how to manage and budget. But what they might need is a little bit of help or a little bit of opportunity to share with their neighbors the strategies that they're using. It's not just about the emergency need. It's that point about catching people before they fall to the bottom, to giving them a hand up before they end up at the very bottom. What it does when you integrate these things together, it creates a positive and social atmosphere where people actually enjoy coming. They may struggle a little bit in the first instance, but once they start coming, they talk to each other and bring their friends in. They talk about making new friends, about sharing with each other, about enjoying the food, about enjoying cooking again, about feeling less stressed. So these kind of interventions are super important, and I really would like to see more in our landscape, and they are emerging, and we're going to hear about them in just a minute. Next slide, please. What we end up wanting, though, is examples of transformation in the end. And I won't go into this in great depth, but really, again, let me just reiterate, it doesn't have to be economic transformation. It can be things like where people start sharing with each other, When we see this, we see that people are less afraid, that the crime rates go down, that children's school attendance goes up. It's amazing the difference that these sort of social interventions can make. Next slide, please. When we bring all these elements together, this is where the alchemy happens, as my friend Gary likes to say. There is no hierarchy or distinction or stratification. We have people across the food chain interacting and interconnecting with each other. Those social divisions disappear, and we have the kind of communities where we want to live and grow old and raise our children. So thank you very much. Next slide, please. If you are interested in the work that I do, that's a little bit there. And please also do get in touch with me. I'm happy to talk to anybody about any of this work. Thank you.
We have roving mics here, folks. So if there is a question, just put your hand up. There's one down here.
Hi, Megan. Thanks for a brilliant presentation. And you touched there on the toll of food insecurity, food poverty, on both mental health and physical health. And I do think as a society, we may be more aware of the physical consequences. And my question is, how do we actually raise awareness around the effects, the impact of food poverty on mental health?
I'm not sure. It's really interesting when you go into community organizations where the target and the narrative is around mental health rather than physical health, when it's about socializing and even addressing issues around social isolation, although nobody wants to really admit that they're really no mates. Those sort of narratives resonate actually better rather than that link between food insecurity and mental health. If you talk about mental health, people will come. If you talk about, there's a fantastic organization in Newcastle that's a men's pie club. And it's absolutely about addressing men's mental health and their food insecurity and introducing to them some cooking skills about how to make pies. But what they do is they make pies together, they eat together, and then they sell the pies at the local football. And then they donate the money from the pies either back to keeping the club or going, but also so people feel like they're doing well and doing good. So it's that kind of connective, positive sort of statements. I don't think we need to, and if we're talking about policy, absolutely we need policy. We need better mental health support in this country. But those sorts of activities can be really, really helpful. Does that kind of answer your question?
Hi, Megan. Sorry, I'm up at the back here. There's a question that's come in online. You presented on those more vulnerable to food insecurity. There are two groups in particular that I'd like to know more about. So people with long-term conditions and people with poor health. Is it a chicken and egg scenario? Do we actually know what is more likely to happen first? So whether they get sick first or whether they're food insecure first?
We don't really know, actually. I mean, you slip in and slip out of food security. It's not like something that happens to you just one day suddenly, or, it's not like, oh, today I'm fine and tomorrow I've got it. So it's hard to know, diets begin to deteriorate. So diet-related poor health can result from, partially from cutting back on those fruits and veg, from cutting down on that healthy diet, from not getting the exercise that we need. So I don't know what's first, actually. It may be that you have a health problem first and that translate into food security, and it could be the other way around. We know that there is a relationship between diet and diet-related poor health and food insecurity that kind of ends up in food insecurity or and vice versa. I'm sorry, I'm not answering that question very well. It can be both ways. It's a recursive relationship. How's that for a short answer? We don't know actual numbers.
There's another questions come in online. Are there any countries with the same issues of food insecurity that we can learn from?
That we can learn from? We can learn what not to do, absolutely, from the United States. They have a worse situation than we do. If you look at some of the countries where income inequalities are not as deep, where those at the bottom are not so much further at the bottom compared to those at the very top, where there are more connected communities, you find that actually there's less food insecurity. But even in places like Sweden, for example, food insecurity is beginning to increase. So there is definitely a national policy issue. But we can look back even in our own history here in Britain and see when people were more connected, even though the poverty was great. People often say, well, when my parents were young, these are people my age, about 1 million years ago, right? When my parents were young, they always managed, we always had food. Well, life was different then. People knew how to hunt and they knew how to gather food, and it was okay to do that. And they had neighbors who would help them out. And in this current context, we don't have that anymore. That's been lost. So we cannot compare the past to the present, but we can learn from the past.
Hi. So I first have a bit of a comment. We founded a food bank back in 2013 and seen the need for more than food. That's actually one of our projects. And then we were fortunate enough to become one of the social supermarket pilots in 2017 when it launched. And so we've kind of been on that journey that you described this morning in those ladders. So just that's been really encouraging today to hear all your evidence and backup, because sometimes we're so busy doing the work to actually gather the evidence is hard. But I just wanted to confirm, what was the figure you said of people who are in food insecurity who aren't accessing food banks? Because we see that as a big need all the time. How do we reach those people that aren't coming forward? So I just wondered that statistic again.
So the statistic, gosh, I can't remember it off the top of my head. It's somewhere in the mid 20% of those who are severe food insecure are accessing food banks. So the proportion of people who could be accessing food bank, if they're available everywhere, is quite low. It's lower in rural areas. Most people who access a food bank are people who live in very high income deprived places. And the group that's most likely, but even they are quite low, and the group that's most likely to access a food bank support are women with children, 3 or more children, particularly women, families with 3 or more children. The rates are very low for people who are in work, about 7%, even though the numbers are higher, and about 7% for people from BAME categories. According to the FSA data, it might be different otherwise. We don't know how many people are accessing, for example, pantries. I suspect that there is a stigma issue. Nobody wants to be, nobody wants to be linked to poverty, to that language of being in poverty. And the thing about a food bank is that it's always designed as something for the very most needy. And you can always, like I said, you can always point to somebody else who's needier than you. So I do hear people talking about, I don't want to go there because, so there's a whole host of narratives and framings that go around food banks. So getting them to come might just be a case of calling it something different, or giving an opportunity for paying something or for sharing something, time, whatever. So that can make that subtle difference, helping people to feel like they're helping their neighbors and themselves at the same time. So the framing matters enormously. The language of framing matters. Does that? Yeah. And it's great that you're doing. Can I also just say that with the food ladders, these are place-based. And sometimes when I talk to people about the food ladders, organizations get all panicky because they see themselves as a food bank, and then they see themselves on the bottom rung, and somehow it's really bad to be on the bottom rung. And we need levels for all people. People are hungry right now. And not everybody can do everything. But if you network with other people in your area, you can provide everything in place. And so local authorities can support with that as well.
Thanks.
Thank you so much. A really inspiring talk today. It links to quite a lot of work we've been doing with a number of people in the room about food possibilities. So it'd be great to connect and talk about that. I guess one of the challenges that have come up from that, and you mentioned it slightly, is around evaluating what's going on and what's working and how do we share that, because there is fantastic stuff happening all over. You know, we've heard it's there, but what role can we play in terms of understanding how to strategically implement things that make the most difference, and how do we share and learn together, and what's the role of researchers like yourself, like myself, within that? And just something to hear your thoughts on.
So there's a paucity or a lacuna, I love that word, in the literature on actual evaluative work, that's, you know, controlled type evaluations. There is a lot of user survey evaluation from within particular groups. But so many of these things are very small scale and very local. So getting sample sizes, doing anything beyond the qualitative is really difficult. I've been trying to create a diagram or a table that cuts across all the multiple ways in which different kinds of support supports people, from the very basic food bank at one end to low-cost loans at another end, to cooperatives. How do they contribute to those different rungs of the ladder, and what do they do? And what would be needed then? Where can we fill the gaps? Can we figure out what we have? That is a work in progress, and I would really welcome anybody's thoughts on that. So please do get in touch with me, because there are a multitude of difference, and we do need that. People keep asking, well, what do we need? What's the best way? So I wouldn't say there is a best way. I think it's more about being mindful of are we doing things in a way that doesn't value or recognize the assets that people have? Are we doing things that's causing them more work or creating more stress to them? Is it creating greater harm? Despite the fact that we may feel like we're doing, we're trying to help, actually, are we causing harm to people? And how do we get rid of it? What can we do differently to reduce that feeling of stigma, or that loss of self-control, or that loss of self-esteem that happens? So those are some of the things. Can we frame it differently? And that requires quite a lot of basic kind of just thinking, hard work thinking, rather than doing whatever's easiest. So to kind of summarize quickly, there's a lot of stuff going on out there. We have no idea what all it is, but we know it's diverse. We know there's a lot of creativity. We are trying to find ways to sort of frame and identify it, and would welcome collaborative interaction with that process, and thinking carefully about, putting an ethical hat on whenever we do anything. Are we causing harm? Are we causing distress to people?